let's talk about, Dr. Toma, the physician culture, your group, how your group came together when I first met you 20 plus years ago, how you guys formed the group.
Essentially 3 major groups that were in the same area, Walnut Creek, Concord. The plan was not only just to join a group, but actually build a building so that we have a whole center that we all work out of. And then we became very interested in joint replacements. Actually, nobody was doing hip replacements in an ASC at that time. We created a whole program, started from the surgery, the operating room nurses, the staff, the pre-op, and in fact got to a point where we actually made a whole day of a mock patient. But the most important thing was we need to have quality care for these patients.
Dr. Peters and then Shay, you have calls with the physicians, all the surgeons and your staff. Continue to be amazed that most of them show up for the calls. How do you guys motivate them to participate?
I was chief of staff for a couple of years at the hospital, and I always joke that you try to put a meeting together with physicians at the hospital and really nobody shows up. And what's really refreshing at Sequoia with this program is that you really aren't hurting any cats. They want to see the facility succeed. They want to see their patients do well. People are engaged and they want to be part of the decision-making process. I think that's how we continuously learn from each other and improve the process.
I mean, to Dr. Peters' point, I think we're also including the practice management team. So I think that it starts with the schedulers and what's going on in the office and making sure that we get the appropriate patient on our schedule. It's really a team approach, and we do like to get the buy-in from the surgeons and everybody who's contributing to the team and to the committee. We started to get pretty excited as we developed the program and watched it grow. More and more participants started to join the call and add what they were learning and some of their experiences so we could all learn from it.
We had one meeting where I sat down with all the staff and the nurses and I said, you need to feel like you're part of the team. Can you write down some requests of what you want to happen with this program and how you want to be? But that was the kind of the mentality of the group, that we want this program to succeed.
So everybody got behind the vision.
Yep.
Any discussion that we have or any decision we make, we actually make sure it gets followed through, and then we come back to it the following meeting next month. And so I think people see that this meeting is not just a meeting, but it produces results and things get done. So
things are getting done.
Yeah.
That's great.
Yeah.
That's a really good point. That's probably what brings people back.
Right.
Yep.
Like, oh, okay, well, actually it happens, when I go to the meeting.
A perfect example for that, if you remember, I used to use IV Tylenol for my patients during, for post-op pain management. We had a meeting, they showed some articles, and they said, well, patients do just equally well with oral Tylenol. That was the last day I used IV Tylenol.
From that call?
From that day. And that's how, and this was just one little example of that. And that's how all of these decisions are being made and followed through.
Okay, so let's talk about physician credentialing. What's your opinion on the type of physician that are working in the surgery center?
Total joint fellowship training is becoming more of the thing to have if you're going to be doing high volume.
How about fellowship sports trained docs that had as lifelong patients and they maybe 60 or 100 totals they're doing a year? I mean, do you have those type of credentials at Sequoia, and do you see that as something that it will be trending as well?
Yeah, we have 2 of those sports guys that also do, one of them only does uni and one does a lot of totals. And so obviously they're both good at their jobs, which is the most important thing, right? And then so they're not comfortable, they'll refer to one of us. The trend is fellowship is becoming almost standard now. I finished my fellowship in 2015 and I think that really helped in getting a job, especially in the Bay Area. And yeah, everybody in my residency went on to fellowship. So.